Welcome to Men's Health 365. Today we're exploring one of the most overlooked yet fundamentally important aspects of men's health after 60, proper hydration. But here's what most men don't realize. Dehydration isn't just about feeling thirsty or having a dry mouth. Chronic mild dehydration, which affects the majority of older men without them even knowing it, directly contributes to erectile dysfunction, prostate problems, kidney stones, urinary tract infections, cognitive decline, joint pain, constipation, and even increased risk of heart attack and stroke. If you're watching this video, hit that subscribe button right now. We share evidence-based health strategies specifically for men over 60 every single week. Also, drop a comment below telling us which country you're watching from. We love seeing our global community grow. Let me share Kenneth's story. Kenneth is a 71-year-old retired construction supervisor from Perth, Australia. For over 3 years, Kenneth dealt with progressively worsening health issues that seemed unrelated. He experienced frequent urinary tract infections requiring antibiotics. He developed painful kidney stones twice within 18 months. His joints ached constantly, particularly his knees and lower back. He struggled with chronic constipation despite eating fiber. His energy levels were perpetually low, and he felt mentally foggy most afternoons. He experienced occasional dizziness when standing. Most concerning, his erectile function had declined significantly. Kenneth visited multiple doctors and specialists. He was prescribed medications for various symptoms, but nothing addressed the underlying problem. Then, during a routine physical, a perceptive nurse asked Kenneth detailed questions about his daily fluid intake. Kenneth admitted he rarely felt thirsty and typically drank only 2 to 3 glasses of water daily, plus 2 cups of coffee in the morning. The nurse explained that his thirst mechanism, which naturally diminishes with age, was failing to signal his body's actual needs. She suspected that chronic dehydration was the common thread connecting all his seemingly unrelated health problems. Kenneth was skeptical that something as simple as drinking more water could make a real difference, but he committed to trying. He started drinking 8 to 10 glasses of water daily, spreading intake throughout the day. Within just 2 weeks, Kenneth noticed his afternoon mental fog had lifted. Within 1 month, his joint pain had decreased noticeably. Within 3 months, his chronic constipation resolved completely. He hasn't had a urinary tract infection or kidney stone in over 2 years since improving his hydration. Most remarkably, his erectile function improved significantly. Today, at 71, Kenneth credits proper hydration as the single most impactful change he's made for his health. Let's explore exactly why hydration matters so profoundly for men over 60. First, let's understand why older men are particularly vulnerable to dehydration. As we age, several physiological changes increase dehydration risk. The thirst mechanism in the brain becomes less sensitive. While a younger person feels thirsty when body water drops by 1 to 2%, older adults often don't feel thirsty until dehydration reaches 3 to 4%, which is already causing harm. Kidney function naturally declines with age. By age 70, kidney function typically decreases by 30 to 40% compared to age 30. This means kidneys are less efficient at concentrating urine and conserving water. Total body water content decreases with age. Young adults are approximately 60% water by body weight, while adults over 65 average only 50 to 55% water. This reduced water reserve means dehydration occurs faster. Many medications commonly taken by older men have diuretic effects, increasing water loss. These include blood pressure medications, particularly diuretics and ACE inhibitors, antidepressants, antihistamines, and even over-the-counter pain medications. Chronic health conditions common in older men affect hydration. Diabetes causes increased urination. Prostate enlargement causes frequent urination, including overnight. Mobility limitations make it physically harder to get up frequently for water. Some men intentionally restrict fluids to reduce bathroom trips, particularly at night, creating a vicious cycle. Research published in the Journal of the American Geriatric Society found that up to 40% of older adults are chronically underhydrated with serious health consequences that are often misattributed to aging rather than recognized as preventable dehydration effects. Now let's explore the specific impacts of proper hydration on men's health, starting with cardiovascular function. Your blood is approximately 90% water. When you're dehydrated, blood volume decreases and blood becomes thicker and more viscous. This forces your heart to work significantly harder to pump blood throughout your body. Research published in the European Heart Journal followed over 15,000 adults for 25 years. Those who stayed well hydrated had significantly lower rates of heart failure compared to those who were chronically underhydrated. Dehydration increases blood pressure because your body releases hormones that constrict blood vessels to maintain pressure despite reduced volume. Chronic elevation damages arterial walls. Dehydration also increases blood clotting tendency, raising risk of dangerous clots that cause heart attacks and strokes. A study in the American Journal of Epidemiology found that drinking 5 or more glasses of water daily reduced heart attack risk by 41% in men compared to men drinking 2 or fewer glasses daily. That's a massive protective effect from something as simple as adequate water intake. The mechanism involves maintaining optimal blood viscosity, electrolyte balance, and vascular function. For men over 60 with existing cardiovascular risk factors, proper hydration is a simple yet powerful protective measure. Second is the impact on kidney function and urinary health. Your kidneys filter approximately 200 liters of blood daily, removing waste products and excess substances while conserving what your body needs. This process requires adequate water. When you're dehydrated, your kidneys must work with concentrated, limited fluid. Over time, this chronic strain accelerates kidney function decline and increases risk of kidney disease. Dehydration is the primary risk factor for kidney stones, one of the most painful conditions men experience. When urine becomes too concentrated, minerals like calcium oxalate crystallize and form stones. Research shows that increasing water intake to produce at least 2 liters of urine daily reduces kidney stone recurrence by 60%. For men with benign prostatic hyperplasia or prostate enlargement, there's often confusion about fluid intake. Many men restrict fluids thinking this will reduce urinary frequency. However, concentrated urine actually irritates the bladder more, causing increased urgency and frequency. Adequate hydration produces more dilute urine that's less irritating, often reducing symptoms. A study in the Journal of Urology found that men with BPH who increased hydration reported improved urinary symptoms and quality of life. The key is timing fluid intake earlier in the day and reducing intake 2 to 3 hours before bedtime. Third is the profound effect on cognitive function and mental clarity. Your brain is approximately 75% water and is extremely sensitive to hydration status. Even mild dehydration of just 1 to 2% body water loss significantly impairs cognitive performance. Research published in the Journal of Nutrition examined the effects of mild dehydration on cognitive function in older adults. Dehydrated participants showed impairments in attention, memory, executive function, processing speed, and mood. They reported increased fatigue, confusion, and difficulty concentrating. The remarkable finding was that these impairments occurred before participants felt subjectively thirsty, meaning they were unaware they were dehydrated. For older men concerned about cognitive decline and dementia risk, hydration is a simple modifiable factor. Studies using brain imaging have shown that dehydration causes temporary brain tissue shrinkage. Chronic dehydration may contribute to accelerated brain aging. Conversely, maintaining proper hydration supports optimal neurotransmitter function, nutrient delivery to brain cells, and waste removal through the glymphatic system that clears toxic proteins associated with Alzheimer's disease. If you experience afternoon mental fog, difficulty concentrating, or memory lapses, inadequate hydration may be contributing significantly. Fourth is the impact on joint health and mobility. Cartilage, the cushioning material in your joints, is approximately 80% water. adequate hydration maintains cartilage integrity and the synovial fluid that lubricates joints. When dehydrated, cartilage becomes more brittle and less effective at absorbing shock. This accelerates wear and tear, contributing to osteoarthritis progression and increased pain. Intervertebral discs in your spine are also highly dependent on hydration. These discs act as shock absorbers between vertebrae. They contain a gel-like nucleus that's approximately 90% water in youth, but decreases with age and dehydration. Maintaining hydration helps preserve disc height and function, reducing back pain risk. A study in BMC musculoskeletal disorders found that people with osteoarthritis who improved their hydration status reported reduced joint pain and stiffness and improved mobility. The anti-inflammatory effect of proper hydration also contributes to reduced joint inflammation. For active older men who exercise, hydration is critical for preventing exercise-related joint damage. During physical activity, you lose significant water through sweat. Exercising in a dehydrated state increases injury risk and impairs recovery. Fifth is the effect on digestive health and regularity. Your digestive system requires adequate water for optimal function at every stage. Saliva production decreases with dehydration, impairing the first stage of digestion. Stomach acid and digestive enzyme secretion are water dependent. Most importantly, your colon absorbs water from food waste to form stool. When you're dehydrated, your colon extracts maximum water from waste, resulting in hard, dry stool that's difficult and painful to pass. Chronic constipation is extremely common in older men and is primarily caused by inadequate fluid and fiber intake. Research shows that increasing water intake is more effective for constipation relief than increasing fiber alone. Fiber without adequate water can actually worsen constipation. The combination of sufficient fiber, approximately 25 to 30 grams daily, and adequate water produces soft, easily passed stool. Chronic constipation increases risks beyond discomfort. Straining increases pressure in pelvic blood vessels, contributing to hemorrhoids. Chronic straining can weaken pelvic floor muscles, worsening urinary control. Constipation can also contribute to urinary retention by compressing the bladder and urethra. Sixth is the surprising impact on sexual function and erectile health. This connection surprises many men, but the mechanism is straightforward. Erections depend on adequate blood flow into the penis. Blood volume and flow are directly dependent on hydration status. When dehydrated, blood volume decreases and blood becomes more viscous, reducing flow throughout the body, including to erectile tissue. Multiple studies have found associations between chronic mild dehydration and erectile dysfunction. A study in the International Journal of Impotence Research found that men with ED who improved their hydration status showed improvements in erectile function scores. The improvement was modest but noticeable and completely free without any side effects. Beyond direct blood flow effects, dehydration affects sexual function through multiple pathways. Fatigue and low energy from dehydration reduce libido and sexual desire. Hormonal function is affected, as dehydration increases stress hormones that suppress testosterone production. Mood effects of dehydration, including irritability and depression, reduce interest in intimacy. For comprehensive sexual health, hydration works synergistically with other factors like cardiovascular health, hormonal balance, and psychological well-being. Seventh is the impact on body temperature regulation, particularly important for older men. Your body regulates temperature primarily through sweating and blood flow to skin. Both mechanisms require adequate hydration. Older adults have reduced sweating capacity and diminished ability to sense temperature changes, increasing our heat illness risk. Dehydration dramatically impairs temperature regulation. Without adequate fluid, your body cannot produce sufficient sweat for evaporative cooling. Reduced blood volume limits blood flow to skin for heat dissipation. This puts dehydrated older men at serious risk during hot weather or exercise. Heat exhaustion and heat stroke are medical emergencies more common in older adults, particularly those who are dehydrated. Symptoms include dizziness, confusion, rapid heartbeat, nausea, and in severe cases, loss of consciousness. Prevention through adequate hydration is far superior to treatment. If you live in a hot climate, work or exercise outdoors, or don't have air conditioning, hydration becomes even more critical. During heat waves, emergency room visits and deaths among older adults spike primarily due to dehydration and heat illness. Eighth is the effect on detoxification and waste removal. Your body constantly produces metabolic waste products that must be eliminated. Your kidneys filter waste from blood and excrete it in urine. Your liver processes toxins and eliminates them through bile. Your lymphatic system collects cellular waste. All these systems require adequate water to function effectively. When dehydrated, waste products accumulate in your body, contributing to feelings of fatigue and unwellness. Concentrated blood with waste products can damage tissues. Inadequate urine production allows waste to sit in the bladder longer, increasing infection risk. Your body also stores certain toxins in fat tissue when elimination pathways are overwhelmed. Proper hydration supports efficient elimination, reducing toxic load. This is particularly important for men taking multiple medications, as drug metabolites must be eliminated through kidneys. Dehydration can lead to medication accumulation and increased side effect risk. For men with chronic conditions requiring medications, maintaining hydration helps ensure drugs are properly processed and eliminated. Ninth is the impact on immune function and infection resistance. Your immune system relies on your lymphatic system to transport immune cells throughout your body and to sites of infection. Lymph fluid is primarily water. When dehydrated, lymph becomes more viscous and flows more slowly, impairing immune response. Mucous membranes in your respiratory and urinary tracts are your first defense against pathogens. These membranes require adequate hydration to maintain the protective mucus layer that traps and eliminates bacteria and viruses. When dehydrated, these membranes dry out and become less effective barriers. Research has shown that people who maintain adequate hydration have fewer upper respiratory infections and urinary tract infections compared to chronically dehydrated individuals. For older men, UTIs are particularly concerning as they can lead to serious complications, including kidney infections and sepsis. Maintaining hydration is one of the most effective preventive measures. The mechanism involves both mechanical flushing of bacteria from the urinary tract and maintaining healthy mucosal barriers that resist bacterial attachment. 10th is the effect on medication effectiveness and side effect risk. Many men over 60 take multiple daily medications. Proper hydration affects how medications are absorbed, distributed, metabolized, and eliminated. Some medications require adequate water for proper absorption in the digestive tract. Dehydration can lead to unpredictable absorption and blood levels. Many medications are metabolized in the liver and eliminated through kidneys. Both processes require adequate water. Dehydration can slow elimination, leading to medication accumulation and increased side effects. Some medications become more concentrated in dehydrated states, increasing toxicity risk. This is particularly true for medications with narrow therapeutic windows, like digoxin for heart conditions or lithium for mood disorders. Conversely, some medications require adequate hydration to reach therapeutic levels. Healthcare providers assume patients are adequately hydrated when prescribing medications. If you're chronically dehydrated, your actual medication response may differ significantly from expected. This can lead to inadequate treatment or excessive side effects, both potentially dangerous. Now let's discuss practical strategies for optimal hydration. The traditional recommendation of 8 glasses daily is a reasonable starting point, but individual needs vary based on body size, activity level, climate, medications, and health conditions. A more precise approach is to aim for urine that's pale yellow, like lemonade. Dark yellow urine indicates dehydration. Clear urine suggests overhydration, which is rarely a problem but can occur. Research suggests older men should aim for approximately 2 to 3 liters of total fluid daily from all sources, including water, other beverages, and water-rich foods. The timing of fluid intake matters significantly. Distribute water consumption throughout the day rather than drinking large amounts at once. Your body can only absorb a certain amount at one time. Excess is simply eliminated. Start your day with 1 to 2 glasses of water. You've gone 8 hours without fluids overnight and are naturally somewhat dehydrated upon waking. Drink regularly throughout the morning and afternoon. Include a glass with each meal and between meals. Reduce fluid intake 2 to 3 hours before bedtime to minimize nighttime bathroom trips that disrupt sleep. However, don't eliminate fluids entirely in the evening. A small glass with dinner is appropriate. Plain water is ideal, but variety can help if you find plain water boring. Herbal teas count toward hydration. Avoid or minimize caffeinated beverages. While moderate caffeine doesn't cause significant dehydration as once believed, it does have mild diuretic effects. Coffee and tea can contribute to fluid intake but shouldn't be your primary source. Avoid or severely limit sugary drinks, including soda and fruit juice. These add unnecessary calories and sugar that contribute to obesity, diabetes, and other health problems. Avoid alcohol or drink it minimally. Alcohol has significant diuretic effects and contributes to dehydration. If you drink alcohol, consume an equal amount of water alongside. Include water-rich foods in your diet, 85 to 95% water. Vegetables like cucumbers, lettuce, celery, and tomatoes are similarly high in water content. Soups and broths contribute significantly to hydration. A cup of vegetable soup provides hydration plus nutrients. Keep water easily accessible. Keep a water bottle with you throughout the day. Many people simply forget to drink when water isn't visible and convenient. Set reminders if needed. Phone alarms or apps can remind you to drink regularly until it becomes habit. Monitor your hydration status through urine color and frequency. You should urinate approximately 6 to 8 times daily. Less frequent urination may indicate inadequate intake. Be particularly vigilant about hydration during hot weather, when exercising, when ill with fever or vomiting or diarrhea, and when taking medications with diuretic effects. These situations dramatically increase fluid needs. Don't wait until you feel thirsty to drink. Remember that thirst sensation diminishes with age and isn't a reliable indicator. Drink on a schedule whether you feel thirsty or not. Let's return to Kenneth's story. After understanding the importance of hydration, Kenneth developed a systematic approach. He starts every morning with 16 ounces of water immediately upon waking. He drinks another 16 ounces mid-morning. With lunch, he drinks 12 ounces. Mid-afternoon, another 16 ounces. With dinner, 12 ounces. He stops fluids at 7 p.m. to minimize nighttime bathroom trips. This schedule provides approximately 80 ounces, or 2.4 liters daily. Kenneth uses a marked water bottle that helps him track intake visually. He keeps water bottles in his car, at his desk, and on his nightstand. The results transformed Kenneth's health and quality of life. His chronic constipation resolved within 3 weeks. His joint pain, which he'd attributed to arthritis and aging, decreased by approximately 60% within 2 months. His mental clarity improved dramatically. He no longer experiences the afternoon mental fog that had plagued him for years. His energy levels are consistently higher throughout the day. Most significantly, he hasn't developed any kidney stones or urinary tract infections in over 2 years since improving hydration. His erectile function improved noticeably, which he attributes to better circulation and overall health from proper hydration combined with other healthy lifestyle factors. Kenneth says that proper hydration is the simplest yet most impactful health change he's ever made. He wishes he'd understood this decades earlier. He now recommends aggressive hydration to all his friends dealing with various health issues, many of which he suspects are partially driven by chronic dehydration. Will every man see Kenneth's dramatic results? Individual responses vary based on starting hydration status, existing health conditions, and other lifestyle factors. Men who are severely dehydrated will see more dramatic improvements than those who are only mildly dehydrated. However, virtually everyone benefits from optimal hydration. Even if you don't notice subjective improvements, you're protecting your kidneys, cardiovascular system, brain, joints, and overall cellular function at a fundamental level. If you're over 60 and haven't been intentional about hydration, start today. Begin tracking your fluid intake for several days to establish your baseline. Most men are surprised to discover they drink far less than they thought. Gradually increase intake toward the 2 to 3 liter daily goal. Make water easily accessible throughout your day. Monitor your urine color as a simple hydration indicator. Pale yellow indicates good hydration. Be patient as your body adjusts. Increased bathroom frequency in the first week or two is normal as your body adapts. This typically normalizes as your bladder adjusts to regular hydration. If you have heart failure, kidney disease, or other conditions requiring fluid restriction, consult your doctor before significantly increasing fluid intake. These conditions require individualized fluid management. For most men without these specific conditions, increasing hydration is safe and beneficial. If you have concerns, discuss them with your healthcare provider, who can provide guidance based on your individual health status. Before we wrap up, hit that subscribe button if you haven't already. We're building a community of men over 60 who want evidence-based health information. Drop a comment below telling us which country you're watching from. To summarize, proper hydration profoundly impacts cardiovascular function by maintaining blood volume and reducing heart attack and stroke risk, kidney function, and urinary health. By preventing stones and infections, cognitive function, and mental clarity by supporting brain structure and neurotransmitter function. Joint health and mobility by maintaining cartilage integrity and lubrication. Digestive health by preventing constipation and supporting nutrient absorption. Sexual function by maintaining blood volume and flow for erections. Temperature regulation, particularly important during hot weather. Detoxification by supporting kidney and liver waste elimination. Immune function by maintaining mucous membrane barriers and lymphatic flow. And medication effectiveness by supporting proper drug metabolism and elimination. Practical strategies include aiming for 2 to 3 liters of total fluid daily, timing intake throughout the day with reduced evening consumption, choosing water as your primary beverage, including water-rich foods in your diet, keeping water easily accessible, setting reminders until hydration becomes habitual, and monitoring urine color as a simple indicator, with pale yellow being ideal. Kenneth's story demonstrates how addressing chronic dehydration can resolve multiple health problems simultaneously and dramatically improve quality of life. Proper hydration is free, simple, and among the most powerful health interventions available. Thank you for watching. Men's Health 365. We'll see you in the next video with more evidence-based strategies for men over 60.